Hello everyone! The focus of this video is going to discuss the importance of nutrition in solving hunger, developed with an analysis of Mrs. Jellyby from Telescopic Philanthropy, a chapter from Charles Dickens' book, Bleak House. To lay the foreground for our topic, we first need to understand the scope of our issue. Hunger in the United States is an important concern, and it must be adequately responded to. According to the USDA, 18 million U.S. households faced food insecurity in 2023, an increase of 1 million from the 2022 data. In this study, food insecurity was defined as uncertainty of having or unable to acquire enough food to meet the needs of all their members because they had insufficient money or other resources for food. So we know hunger stands as an urgent problem, but responding to it is not as simple as trying to find food access for all. The UN Zero Hunger Goal defines a perfect solution as one which will, by 2030, end hunger and ensure access by all people to safe, nutritious, and sufficient food all year round. Subsequent indicators on the UN Zero Hunger Goal elaborate on nearly all the aspects of this goal, but nutrition is not expanded on. In fact, the CDC reported 40.3% of American adults were considered obese from 2021 to 2023, directly defining obesity as a BMI of greater than or equal to 30. Because weight acts as an indicator of one's health and is closely linked to diet among other genetic, social, and physical factors, it becomes clear the U.S. approach to hunger is not adequately serving its people. The current approach to hunger in the United States can be better understood with a comparison to Mrs. Jellyby, a selfless, philanthropic woman devoted to the subject of Africa. Through the eyes of Miss Somerton, the narrator, it becomes apparent that Mrs. Jellyby's great preoccupation with helping African natives leads her to ignore her duties to her family, causing their home to become an unkept and undersupplied place where the children suffer from neglect. Mrs. Jellyby lives in London, and as the narrator visits her house for the night, she is introduced to Mrs. Jellyby. Miss Somerton notes the house is poorly lit and hears a child fall down a great flight of stairs with a great noise. When Peepy, the child who had fallen, enters the room where Mrs. Jellyby and Miss Somerton are talking, Mrs. Jellyby pays little mind to the dirt and bruises that cover him, sending him away and immediately resuming a letter as part of her work in Africa. The evening continues on in a similar manner, with more encounters showcasing the dangerous and unclean environment of the Jellyby house, which becomes especially concerning considering the great number of children living there. The climax of the chapter occurs when Caddy, Mrs. Jellyby's daughter, enters Miss Somerton's room to say goodnight and devolves into having an outburst about her hatred for Africa. Caddy summarizes the Jellyby's household saying, "The whole house is disgraceful. The children are disgraceful. I'm disgraceful. Pa's miserable, and no wonder." Mrs. Jellyby's character acts as a parallel for America's overlooked concern for nutrition. Her character argues the unique perspective of how we can take the good concern of hunger and become so overfixated on feeding the basic need of sustenance, we forget to support healthy dieting in those who have food. Mrs. Jellyby's desire to help the destitute creates destitution of those within her household. Her family may be living in filth and hurting themselves as she offers them no protective supervision, but they have a place to live. She does not bother to direct them or check up on them, as in the case of Peepy, even when the conditions of the house raise glaring health and safety concerns. We attempt to reach a large number of people and help them obtain food, but we are not doing enough to promote healthy choices for all. SNAP-ED, the Supplemental Nutrition Assistance Program education, and additional nutrition service programs provide food and try to educate users towards healthy choices. While these programs are wonderful examples of advocating the livelihood of others, they only serve populations below a certain income level. We advocate for those without, but give little consideration to those who aren't considered as struggling because they're able to eke out a survival. Mrs. Jellyby is able to boldly show how something can be so virtuous and yet be incomplete in its desire to serve. In the case of obesity, people may have enough food to eat, but their diet is lacking in balance. Nationally, we are facing a health crisis and continue to ignore it. Those who go hungry still need help and special consideration, but responding to hunger must go further in promoting long-term health for everyone. So how are we to nuance our response to hunger to support wholesome food choices for everyone? In Mrs. Jellyby's case, her family would have improved greatly from more attention and care. She would not have had to give up her philanthropic efforts in Africa, but a redirected focus on her family would have been beneficial for all. Similarly, we should continue to support food assistance organizations and a preferential option for those most in need, but this must not be without nutrition advocacy for all. For family and self-education, the USDA's nutrition.gov site contains information on balancing eating habits, along with recipes promoting the different food groups. For a wider reach, arguing for nutrition education in high schools can bring change to a diverse range of young people. The CDC claims 8 hours of nutrition education are required for high school students, but this statistic is not elaborated on. Speaking with local school boards about your city's requirements and fighting for nutrition in the curricula can help spark change and awareness. Thank you for watching. I hope the connection between Mrs. Jellyby and our focus on hunger helps show the need to consider healthy eating in our response, bringing some new considerations, and maybe even causing you to reflect on how hunger is combated in your own town.